Hello, I'm Dr. Hector Vila, and this video will cover how to practice and prepare for office emergencies. The picture below is from the movie Miracle on the Hudson, and these pilots had extensively practiced on simulators. Because of that, they were able to respond to an actual emergency and safely land the plane in just 3 minutes. This is similar to the time frame that you should be able to respond to emergencies in your office. In this video, we will first examine why we should practice and what are the benefits. We will then look at some scenarios that commonly occur in pediatric dental offices and decide what scenarios we should practice. Then we will help you select a checklist. This can be the checklist that we commonly use, or you can pick one that you think is better suited to your practice. Before starting, you should assign roles to all of your team. You should also prepare the simulation scene with a patient, which can be a stuffed animal or it can be a volunteer staff member. Remember, after running your drills, you should document the drills. This first study showed some of the drill benefits, which include not just technical skill, but improved communication among the team and the teamwork that will produce the best result. Finally, your decision making will be improved by the use of a checklist, which will help guide you in a structured way. Running drills also helps because it allows you to expose your trainees to rare but yet high-risk conditions. It also protects the patients from the trainee and enables the assessment of the training experience. I would recommend that you video with a camera phone or with an iPad your practice drills so that you can look back and assess how well you did. So what should we practice? These are some likely complications from dental offices. They include laryngospasm, sedation overdose, allergic reaction, syncope or fainting episodes, and others. This is a sample dental office emergency checklist. You can use this one or select another one. This checklist is not a nationally approved checklist, and we do not guarantee how effective it is. The first part of the checklist covers the ABCs of basic life support. Initially, when you discover that a patient is in distress, you should call for help. The first thing you should do is check a pulse. If there is no pulse, you must immediately begin pediatric CPR, which includes chest compressions. If there is a pulse, proceed with the rest of the checklist by getting an emergency cart, first doing your airway assessment, which is opening the airway, chin lift and jaw thrust, checking for obstruction, which is removal of any foreign bodies. Typical in a dental office would be a dental dam, clamps, rolls, gauze, etc. Next, check for breathing. If there's no breathing, immediately begin bag mask ventilation. Activate 911, confirm that chest rise or breath sounds are present, confirm that oxygen is actually flowing from the oxygen tank, and check the pulse oximeter reading on the patient. You should target for a reading above 90%. Finally, once airway and breathing are reestablished, check circulation by checking the blood pressure. Once the ABCs are stabilized, you can then begin to determine what is the cause of your patient's distress. Several diagnoses are listed here along with some shortcuts for treatment. You, of course, will have emergency scenarios in your emergency manual, and you should rely on those. These are just shortcuts. Remember that emergency drills are an opportunity to practice. This is not a test. You should be relaxed and expect to have to practice each drill 4 or 5 times until you become good at it. The skills you should achieve are recognition of common problems, an initial response, improve your teamwork, and remember that establishing the airway is critical to a successful resuscitation and emergency response in the office. So begin now by assigning roles. Who's going to do what? You certainly need someone to do the checklist, and they should become familiar with the checklist as well as how fast it should be read off to the team leader. You should also have an assistant assigned to get the emergency cart and be proficient with turning on the oxygen tanks and the ambu bag and making sure everything is connected. Another assistant should be the extra hands for the dentist that can assist with looking for chest movement, breath sounds, and getting medications. The front desk can activate 911 and wait outside to be able to direct EMS into the treatment room. So prepare your simulation scene as depicted here. Remember that the assistant that's at the patient's side will be helping the team leader or dentist. This is a good example of how you can listen for breath sounds by holding the stethoscope while the dentist is ambuing the patient. So practice the checklist a couple of times before you get started on actually doing it. And then practice going through the checklist using the diagnosis and treatment portion to direct your care after the ABCs are stabilized. There is an emergency drill log on the drive which can be used to document your emergency drills. There are also apps available for pediatric emergencies. You should consult these. And finally, get going on practicing your emergency drills so that you too can get your ducks in a row. On this drive are a series of emergency drill videos. The first one is the introductory video that you're watching now. Next are 2 example videos so you can watch doctors actually do bad emergency drills and a good emergency drill. Next, you will find some drill tutorials. You can use your computer to introduce a scenario, and this tutorial will time you through the checklist response. And as I mentioned earlier, there is a sample checklist and emergency drill log that you can download. We hope these items are helpful to you, and please do not hesitate to contact us if you have any questions or concerns. Thank you.